Good afternoon, everyone. This is a really exciting afternoon for all of us. We're excited that you could join us today for our national webinar related to the Office of Child Care Initiative on social emotional wellness for young children. This webinar is going to focus on perspectives from the early care education field related to the implementation of the pyramid model. This webinar is being taped and will be posted on the ECTAS website. We'll put that address in the chat box for you, along with the PowerPoint slides. You'll be able to view the presentation multiple times, look at the PowerPoint slide, and all of our speakers have been so generous with resources, so you'll also see a lot of resources that will be posted there. It'll take us about 2 days to get that posted. So again, a warm welcome to everyone. I'm Laura Johns from the National Center on Early Childhood Quality Assurance. And I'm really excited to have Ellen Wheatley join us. Ellen is the acting director of the Office of Child Care, and would like to turn it over to you, Ellen, for a few words of welcome.
Thank you, Laura. I'm really happy to welcome you on behalf of the Administration for Children and Families and the Office of Child Care, and to tell you how very, very important this presentation is. It was 20 years ago this month that, as the president of the New Hampshire Association for Infant Mental Health, I sent out to all licensed child care providers in the state a survey. Now, I sent it out cold. No one knew it was coming. It just arrived in their mailbox. It had 2 questions. 1, have you in the past 18 months expelled a child? If so, how many? And then a comment section. Over the next few weeks, so many of them were returned. 29% of what we sent out came back filled out, and it was not a representative sample by any stretch of the imagination, but it certainly was telling about the amount of interest there was in expulsion in child care. What we found in that 29% return was that 52% of the expelled 1 or more children in the past 18 months. And in addition, almost 60% had enrolled an expelled child. So what I wanted in that moment, when I realized that, was some way for directors and teachers to understand how important the behavioral and mental health of children really, really is. And I wanted them to understand that children naturally are active. They're naturally curious, and a positive environment can make all the difference. And fortunately, not all that long thereafter, I did discover the pyramid model. And that was a real game changer, because it really emphasizes the positiveness that is needed in childcare and with all young children, and practices that support the mental and behavioral health of young children. So you are really fortunate today to be able to hear a lot more about it. So I'm going to turn this back over to Laura, and I hope you enjoy the presentation.
Thanks, Ellen. So I'm really excited to have a great panel to present to you today. So Lisa Fox is here from the National Center for Pyramid Model Innovations, a tongue twister this afternoon. Susan is here from the Pennsylvania Training and Technical Assistance Network, and Kate Rogers and Lori Meyer are here from the state of Vermont to talk about their experiences. So in a moment, you'll get to meet them and hear more about their work. So a quick word about our agenda. We're going to do a very quick context setting slide, and then I'm going to turn it over to the state presentations from both Pennsylvania and Vermont. Please use the chat box to ask questions, and we will try to get to as many questions as we can, but also can follow up with questions after the webinar. So we will keep a copy of the chat box so we can follow up with you all. And so we'll try to get some questions answered after each state presentation and at the end of the webinar. So just a little bit of context around social emotional wellness and why we're talking about it now. And I think Ellen did the perfect job of helping us with that context. I mean, we certainly know that the effects of the pandemic on the social emotional wellness of young children and their families has really caused all types of multiple hardships from both the family side, but also the child development side. We know that changes in routines have long-term effects on young children. We know people are isolated from families and friends. We know that there is an incredible loss of family members that children are having to experience. We know that the access to the healthcare system is really been cut off. People are afraid to access the healthcare system, even for things like developmental screenings. And so again, there are all these multiple levels of effects of this pandemic. But we also know that even before the pandemic, social emotional wellness was something that each and every one of us who are early care education professionals wanted to focus on. We understand that this piece of development really sets the context for learning and developing and growing. So we're really just excited to put a spotlight on social emotional wellness, and that the Office of Child Care has done a full initiative focused on this content area. So let's start with a poll question. Just wondering if your state or territory or your tribe is currently implementing the pyramid model to support children and families and providers. So let's just get some context going, and you can answer that poll right on your computer, and let us know if you are currently implementing. And let's go ahead and see. So we're getting some good results in. So yeah, so about 75% so far are indicating that they have some experience with this topic and they're implementing. And I will say, for those of you from states that are implementing, we hope that you will share in the chat box your experiences and your comments as the presenters are talking. I think the peer-to-peer interaction is so important, and we learn so much from each other. It also helps us know who to bring up and highlight on future webinars. So we'll move on, and I'd love to turn it over to Lisa Fox to get us started with some just foundational information about the implementation of the pyramid model. Thanks, Lisa.
Sure, thanks, Laura. So many people are familiar with the pyramid model. What I want to do is just stage our discussion, because I think our states are the ones you really want to listen to. They are able to address the practicalities of how you do implementation and scale up. And these two states that we've selected are very deeply steeped, have wonderful insight to share with you, and are being very generous with providing those insights to us. So for folks who aren't familiar with the pyramid model, we think about it as a framework of evidence-based practices. And so when the pyramid model was developed, we had funding from the Office of Special Ed Programs, Head Start, and Child Care to think about what are the practices that promote all children's social emotional competence, and how do we address challenging behavior. So that's every child in every setting, children with and children without disabilities. And early in those years, we built the pyramid based on research to identify what those practices were for children birth to 5. And then since then, we've done studies to look at the impact of implementing the pyramid within a program. So we think about this using a public health framework, or as Vermont will share with you, they they call it a multi-tiered system of evidence-based practices that they bring to bear around social emotional wellness. So at the bottom of the pyramid, it's how do we support how do we promote the social emotional wellness and development of all children. The middle is thinking about the teaching of social emotional skills to all children, but also very focused and intentional, either instruction or skill promotion in our little ones, very intentional practices around making sure that all children, even children at risk of social emotional delay or challenging behavior, have what they need to be successful. And then at the top of the pyramid, being ready for children who present with challenging behavior. I like to think about the pyramid model and our programs that are at high fidelity of implementation as really being able to support the learning of any child that might come to their program, which I think is so vitally important for little ones and their families. So why are we talking about the pyramid model and featuring it in this webinar and bringing it to your attention around children's social emotional wellness? First of all, we know about the link between social emotional competence in the early years, and kind of our job in the first 5 years is really big for helping children enter into school with the skills they need to navigate the learning environment. We also know that the stronger kids' social emotional competence is, the more successful they'll be in school and in their adult life outcomes. We also know if we don't intervene effectively early on, that children often persist in having challenging behavior and have poor adult outcomes. Now, Laura's framed everything so well. We're all aware of the impact of trauma on young children's development. And it's an even greater concern in the pandemic, thinking about the events and hardships that family systems have experienced that may be experienced as traumatic for young children. So I think our awareness of that and our nervousness about what we might confront has been heightened with COVID-19. And I think we're beginning to have some research around the impact of COVID-19 on families, with families reporting more negative moods. They're reporting greater food insecurity, in particular families with young children, reduction in preventive healthcare visits, which we know the impact of that, and then increases in child problem behavior, child fussiness, fear, and anxiety. So all of these are things I'm sure are on your mind. They're on our minds. And we think the pyramid model can really help our practitioners address many of these needs in the work that they do. One of the things that we know from the implementation of the pyramid model is that when people do it well, when teachers are successful, teachers and practitioners, family child care providers, and family members can implement the pyramid practices, they feel more connected to the children, to the program. They are more confident in their ability to use the practices, to feel skilled in promoting social emotional competence and addressing challenging behavior, and they're more successful in doing all of those things. So in our randomized trials, what we found is that when the pyramid model is implemented with fidelity, child challenging behavior for kids who have behavior challenges goes down. Their social interaction skills are increased. And then for children with challenging behavior, their ratings of social emotional skills are increased. We also see improvements in the rating of social emotional skills for all children in the classroom. So some really nice data that overlays on the premise that what we need to do is help all children and promote all children's social emotional competence, as well as be able to address the specific needs of children with behavior challenges. When we hear from states about their evaluation or look at independent evaluation reports of implementation and programs, we see similar wonderful positive outcomes, not just reductions of child challenging behavior and improvement in social emotional competence, but also general improvements in classroom quality, the elimination of the use of exclusionary discipline practices, and stronger relationships with families. That, of course, then leads to increases in children's learning opportunities. So good outcomes all the way around. One of the things that's important as you think about bringing the pyramid model to your state or engaging a more systematic scale up is the use of implementation science along with this framework of practices. And these states that are presenting today are going to do a great job of talking about where they are in that implementation and the elements that they've put together. There are two things I want you to think about. One is that implementation calls for teams. So both state teams to think about implementation and scale up, as well as a program level team. The other is it moves in stages. And so it takes time, multiple years, and you may be in early installation or even exploration in this webinar, moving all the way into full implementation. All of those are considerations, and we actually have a really nice document on the resources page that'll help explain some of that. At the program level, so even at the family child care, the private child care programs that are throughout our communities, the child care programs serving children who are funded with school readiness dollars, even at that level, we have a team. And that team thinks about how to bring the pyramid model to their program. So it takes more than training and practices. It also takes a really thoughtful design of how do we make sure that practitioners can use the practices, engage with families, address challenging behavior, and how to give them ongoing professional development. And so those are the things that those program level leadership teams think about and apply. I'm just now engaged in some training of leadership teams here in Florida, and it's really remarkable how well this resonates with the programs and how eager child care programs, child care centers are to have this kind of content knowledge to be able to strengthen their programs. So I know you're thinking about these things in implementation and social emotional wellness, and we need to integrate all of those concerns. So our emphasis on equity, inclusion, partnering with infant and early childhood mental health consultants to strengthen our programs, the use of trauma-informed care. On our website, we have a lot of resources related to each of these because they all become integrated within the delivery of the pyramid model framework. So I hope you'll go there and explore some of those resources that we have. And I'll stop so that I can turn it over to my colleague, Sue Zeider, who's going to really unpack this in her state for you.
Thank you, Lisa. I'm actually going to interrupt Sue for 1 minute because we had a great question in the chat box, and I wanted to get your expertise on it. The question came from Kimberly, and she was wondering about the linkage between increased social emotional competence in young children and academic or cognitive outcomes.
So there are other studies. I don't have a study on the academic link, so we're talking about a longitudinal study, but there are studies, and Kim, you can find my email on the website and reach out to me if you want some citations around that. But we do know that social emotional competence is foundational to children being successful in school.
Thank you. So now we're going to turn it over to a friend and colleague in Pennsylvania to talk about the Pennsylvania approach to utilizing the pyramid model. So Sue, I'm going to pass it to you. So I think, Sue, we're having some trouble hearing you. So let's just take a pause and see if we can test that.
Okay, everything.
Now
I was seeing thought I was just muted from earlier when we had been muted. So sorry. Well,
That's
welcome
okay.
everyone. My name is Susan Zeiters. I am from Pennsylvania. My role here in Pennsylvania, my official job is that I am a project manager with our Early Intervention Technical Assistance Program. A few key pieces I need to tell you about Pennsylvania. One is that when I refer to early intervention in Pennsylvania, I am referring to birth up until the entry to school. I know that that's different than other people use that language, but that's what it means here in Pennsylvania. A few other pieces that I want to make sure that you understand about are that in Pennsylvania, we are very closely tied with our school-wide positive behavior intervention and supports. So we are more likely to call our pyramid model work program-wide PBIS rather than pyramid model. I may refer to it either way. Today, it's the same thing, whichever words I use. OCDEL, which is a word is likely to come out of my mouth, is actually an acronym for the Office of Child Development and Early Learning, which is the program in is the office in Pennsylvania that encompasses all of our early learning programs. So it's funded by both the Department of Human Services and the Department of Education. So we're all wrapped into one office, which is another one of those key pieces that really have an impact on how we operate some of these things. So just starting off, you will see on the slide that you're seeing now, if you look down in the bottom right corner there, it says papbs.org. That is the URL for this website. And this is the website for our Pennsylvania Positive Behavior Support Network, Birth Through 21. And this is the page where you could go if you are interested in learning a bit more about what's going on in Pennsylvania related to those things. As you would scroll down the home page, you would find near the bottom a map of Pennsylvania, and to the right of that, you will find a link that has our statewide mission. It also has a list of the partners, and the partners that are involved in this work range from the expected partners you expect, like Department of Ed, Department of Human Services, but also things like the Office of Mental Health. Definitely, we have we've had teachers unions involved. We have some private agencies that are out there in the community that are movers and shakers. But so it really is our larger team, and that team is came together looking for how do we address school-based behavioral health back in 2006. Early childhood joined in 2009, and one of the first task that group undertook was the implementation of school-wide and program-wide PBIS and it continues to be our largest and most widespread intervention across the state in order to try to really help the mental health and behavioral health of children from birth through graduation. Let's talk a little bit about, like I said, early childhood has been involved in this work since 2009. So this is really into it for 12 years now. Our goal when we started implementing program-wide positive behavior support, we sort of were playing around with the idea several times, always had some competing priorities that entered in, but we actually got started in 2009-10. And our goal was to reach all programs that are supported by the Office of Child Development and Early Learning. And this slide that you're looking at here, you can see that we are reaching that goal. As with most states, our largest group. Now, the way we gathered this data is that while we implement by building, we collect our data per classroom because it helps us know a little bit more how things are doing. And we often have single programs or single buildings that have multiple funding streams. And you can see that 40% of the classrooms that are engaged in implementing the pyramid model are Head Start, early Head Start. And I think that's not uncommon. But our second largest group is childcare, almost 30%. And I'm really pleased about that because it is a challenging implementation project. And childcare is chronically underfunded, and yet we're getting there. Early intervention, and is again birth through preschool. And when we think about a classroom that might be an EI classroom, these might be an individual classroom within an inclusive building, although more often these are classrooms that are dual funded. So they may have certain number of children that are early intervention and certain number that are another funding stream. Pre-K Counts is our K-4 program in Pennsylvania. Preschool NOS is, we just have a couple of maybe a church runs a preschool. It's kind of a private preschool kind of model. School-age childcare is listed in here, and a very, very few that actually have a kindergarten classroom. This is, and like I said, we wanted to reach across Pennsylvania. This is where the sites in Pennsylvania are physically located. And there are a couple of key pieces here. One is, as you can see, we have some clusters and we have some bare open spaces. Well, just because this is an Allegheny National Forest does not mean nobody lives there, and yet we got a big hole there. A couple of really significant things that I see when I look at this map. One is, this is Pittsburgh. It is our second largest city, and it has a gaping hole. There are a number of reasons for that, including one colleague of mine who says, well, I broke Pittsburgh. Which of course is not true. But the point being, that for whatever reason, we've not gotten a lot of traction there. But what's really interesting about looking at this map is when we talk about funding in a little bit, we will talk about some early intervention, early childhood partnerships that we used some funding grants to grow this system. And when I look at this is it. This is one of those partnerships. This is one of those partnerships. These are a couple of large Head Start programs that go right along Route 80. This is a large Head Start program. This is some partnerships with some local grant kinds of things. So that this is one of those early intervention, early childhood program partnerships in a very sparsely populated area. So that's one of the key things that we have learned, is that implementation partners are hugely helpful. They are much more likely to stick and continue to implement as they move along. And when we think about, we have not been taking data on race, ethnicity, et cetera, for our individual children, but we do collect information about how many are enrolled altogether, and we have about for 2019, for 2019-2020, we had about 10,000 children enrolled in classrooms that are implementing program-wide PBIS. And of those, about 20% have an IEP or an IFSP. About 8%, I think, are dual language learners, and then we have a very small number who have behavior plans. And that is some of the data that we collect on those issues. These are some of the things that some funding that has helped us move forward. And one of the things that's different about Pennsylvania is the funding of our entire PAPS network. It is not a line item in the state budget. It is, and in fact, of all the involved state departments, the way we all contribute to the work is that people do what fits within their work scope. For instance, that website that I shared initially is funded by the Office of Mental Health. They sustained some of that stuff on a website of their own, and they said, you know what? Yep, we can do that. We can create and maintain that for the network. We have some specific roles, both at school age and at early childhood, that have been really in keeping it all organized. My role as the coordinator for the early childhood aspect of it really pretty much fits within the scope of my early childhood special ed technical training and technical assistance role because of the emphasis of how much this supports children with disabilities and inclusion, as well as the larger network. So those are some of those things that has been both a strength and a challenge for us. The strength of it not being any one line item is that it's really hard. If you wanted to get mad at the pyramid model or school-wide positive behavior support and say, let's get rid of them, there's no one budget to attack because it's just built into a lot of different people's work. That's also one of the challenges in figuring out exactly who's going to do what and how do we reorganize things and some of that stuff. We definitely use our professional development budgets. The project I work for is statewide support for all early intervention training and technical assistance. We have another unit in Pennsylvania called the Pennsylvania Key, which really oversees training and technical assistance for Head Start, child care, some of those things that are the state-supported Head Start, the child care, pre-K counts, those kinds of things. We have some resources from the Office of Child Development and Early Learning themselves. The resources we get tend to be more people than money, but some of that is also saying, I can provide that training. I can provide this FTE for this amount of time, or, some of those pieces. We have built in policy updates that have incorporated pyramid model strategies and implementation strategies into revisions that have happened to things like QRIS standards, early learning standards, any of those pieces that are things that need to be done anyway, that makes it easier for people to prioritize implementation of the program of a pyramid model because it helps them do their good work anyway. That has really been huge. The idea that coaching is now an expectation in quality rating is a big help, because that used to be one of the big barriers. Like, we don't know how to do coaching or how to allow for that. Well, they need to do that anyway. So now that makes implementing pyramid model with fidelity less daunting. And our partnership with School-Wide PBIS has actually helped us with our financing too. We have done an annual implementers forum every year. Big party, it's a conference, but it also has a celebration piece at the same time. And it has, we missed it last year due to COVID, but other than that, we still had the celebration in November via Zoom. We could not do that as early childhood on our own. That partnership really helps. Every year we do facilitator day to make sure our program leaders, our program coaches are staying current and up to date. We do coaches day together, those kinds of things. It really is a huge help to have that larger system partner. It also generates interest at the school age level in the early childhood partners. We've actually had a few school districts reach out to child care programs in their area and saying, how do we get these kids on board before they get to kindergarten? How can we work together to make this go well for kids? So those are some things that really have been helpful for us. At the local level, the way folks have funded this, we have done some early intervention, early childhood partnership grants. They have come through Early Intervention Technical Assistance, the program I work with. And the expectation has been that the early intervention program would actually support and work with one or more early childhood programs to help them get started with their pyramid model implementation. This has been, as we go back and look at that map, because I know where they are, I can definitely see the boundaries of those early intervention programs and how they have supported their partners. We have also found that they tend to stick. Sometimes programs come to us independently, and if they don't kind of connect with somebody else, it can be harder to keep it going. If there's someone else in their community that they're working with, When I'm lagging, you'll pick me up, and when you're lagging, I'll pick you up. In Philadelphia especially, we have, and actually in some other parts across the state, we have some community philanthropy agencies that have provided some grants for early learning programs to get started with their PBIS implementation. And in Philadelphia, we've had some research grants where they've actually set some things up and been reporting back about how PBIS or pyramid model is working and what progress it can make for young children. Also, to help the local level, OCDEL, the Office of Child Development and Early Learning, has provided guidance to programs about how their state funds can be used for implementation tasks. So where the work of the pyramid model aligns with the work of quality implementation, how they can use those funds and where. And then, of course, people are just coming up with things out of their own local budgets, figuring out how are we going to provide extra coaching time and work on these pieces to find time for staff to meet and all of those issues. These are some of the policies that we've come up with in Pennsylvania to support the pyramid model. One of the things that we've been pretty diligent about is trying to use the language of the benchmarks of quality to describe some of the practices that we want to see in quality services without necessarily saying you have to implement the pyramid model. Because again, it's that combination of things that we don't run afoul of anybody by appearing to over promote any one brand of something, but on the other hand, we are building in all of those quality practices. It makes it easier for programs to then implement pyramid model because those expectations are already written into what's expected of them, and it also pyramid model very clearly, they can see the match very clearly. So some of the explicit things that have been put in that way have been an expectation of shared leadership at the upper tiers of the quality rating system, building in coaching of staff, building in the use of data and an expectation that decisions will be made based on data. Those are exactly the things that in the early years, everybody said, this is too hard. We can't do all of these things. Well, now it's written into the quality rating system anyway. So yes, it's still hard, but they can see the value. Something else that's kind of unique in Pennsylvania, and this was definitely an outgrowth of our partnership with Schoolwide, is that we have a process for providing recognition for fidelity of implementation from the PAPS network. And it happens at tiered level. There's universal and then advanced tiers, then you can get recognized at tier 1 and 2 or recognition at tier 1, 2, and 3. To develop that, we kind of went with what some states are doing at Schoolwide and made enough adaptations to make it appropriate for early childhood, but not as many as maybe some of you would have made, because we also really want to sustain that partnership with Schoolwide. But one of the things that has really helped with policies is that in the latest QRIS revision, programs can now earn some bonus points toward either achieving a higher star level or maintaining their star level if they earn recognition at the universal tier from the PAPS network, which has actually generated some additional interest, especially on the childcare side. And if you look at our early learning standards, you will see a lot of pyramid model practices in there, not called out as pyramid model practices, but they are definitely there. So again, it's just infused into some of the expectations of quality services in Pennsylvania. These are some of the challenges and barriers, and if I had answers for them, I'd be happy to share them, but of course, that's why there still are challenges and barriers. One of the things is that supporting all stages of implementation at the same time is really hard. And I don't know that we will ever get away from doing that, because we will always have people who are in exploration and in installation, and in full implementation. There are always new people coming on, even experienced people that have some turnover. It's the same issues that local programs struggle with. And it is one of the things that we continue to struggle with. We're in the process of doing some revamping some things simply because we aren't moving deeply enough, far enough, hard enough on some of the upper tiers because we keep working on some of the lower tiers. We need to figure out how to spread this out a bit more. A challenge is the belief among some early learning staff that program-wide implementation is just too hard or that it's not really necessary. We have what a friend used to refer to as those who want to use the Chinese menu approach. Oh, we're doing PBIS, but we're not doing that core leadership team thing. Oh yeah, we do PBIS, but we're not doing any data stuff, No, you're not doing program-wide implementation if you're not doing data systems practices toward outcomes, data systems practices toward outcomes. We need to be thinking about those things all the time. And we also face the challenges, as everyone does, of competing priorities. It's not that people don't think it's important or that it's good. There's just lots of other things that also would be nice to do or good to do. And how do we weigh those things out? Okay. Suddenly I just had a moment of panic thinking I was way over my time. I'm exactly on. These are some of our lessons learned. Number one is commitment is essential. We always tell programs when they're considering it, if the director wants this to happen, it will happen. If the director doesn't want it to happen, it definitely won't happen. And if the director says, well, go ahead, you can do that if you want, it's not going to happen. We really need leadership to be all in, and that's true at the state level too. As I mentioned before, implementation partners increase sustainability. It is very rare that we have a program that doesn't run into a bit of a wall someplace along the line, whether, staff changes or just, getting a bit overwhelmed, any of those pieces. So if we can help people develop some partnerships, it really does increase sustainability. The resources created by NCPMI are so invaluable. We could not possibly, first of all, in Pennsylvania, we create some pretty good quality stuff, but there's no way we could create as much stuff as they do and do it with such quality. We don't have the resources for that. So that is just so helpful, and it really makes it, I think about the early years and how frustrated some folks were because we just didn't have everything that we needed. Well, now it's available. We just need to help people learn how to use them. And expanding, and I would strongly recommend that folks expand their partners beyond state early learning leadership. As I mentioned before, we have school-wide PBIS implementers, mental health agencies. We have higher education as part of our state team. Region 3 Head Start TA is a member of our early childhood subcommittee that helps us focus strictly on our early childhood things. And we do some sharing back and forth. They have an empty seat at a training. We make it available to someone in the state that could attend. We have some empty seats. We make them available to the TA system. Do you have anybody that who needs teapot training or whatever? So it works out well for all of us. And also, one of the things that we sometimes have had and sometimes not, but it really is helpful, is one or two local agencies at your state level to be able to really speak about what are they experiencing at that end, what are their staff, how are they experiencing the work that the state team is doing, et cetera. It has really helped us know when we're on track and when we need to rethink some things. This is what we have managed to accomplish. The growth in the number of enrolled programs and the number of programs reaching fidelity, this year accepted, because we have 1,000 things that are different this year. But over time, the growth has really been fairly consistent, continuing. The rate of growth has continued to grow year to year. The elements of program-wide implementation are embedded in quality service delivery expectations. And that is one of the things that I feel pretty good about, is that even if a pyramid model project as such in Pennsylvania went away, a lot of the practices would still be expected because they've been built into the system. And that Pennsylvania's pyramid model work and our infant and early childhood mental health consultation program have a very strong shared commitment, but they work in a complementary rather than a duplicative or competitive method. We have some programs that are implementing program-wide PBIS or pyramid model and who also access early childhood mental health consultation, but they far more do one or the other. And we really looked at why is that, but we have found that we're able to, sometimes the mental health consultation helps get programs started with PBIS, and sometimes we move on. They're able to not need it because they're already doing PBIS. And the last thing I wanted to share with you is a bit about, so where are we now and what do we still need? And so, as I said, this is our 12th year, and we are currently working on restructuring our pyramid model supports. One of the things that, it takes a couple of years to get everything in place, but then sustaining it for the rest of your life is another whole project. And I would say we are in that stage now as we figure out we've built some of the basic expectations into the infrastructure. How do we really make sure that someone managing it and knowing, managing enrollment, managing supports, managing higher tiers, how do we keep that going at a consistent method? That's what we are really working on, making sure that we do well. And anybody have any great ideas? You've really solved that problem. I'd love to have a chat. We're working on that. And now I would like to, that's the end of my session. I will pass things on to Kate, but it looks like first Laura's going to jump in.
I am. I was going to jump in. So first, I want to highlight a couple things that you said. You did a couple shout outs for the National Center on the Pyramid Model Innovation and Lisa's work at that National Center. This is such a great resource. And Lisa, thank you for chatting in the chat box with all these resources. Maybe you'll just throw in your website address one more time. Remember that we'll have links on our website. It's a web page that has a whole lot of resources for social emotional wellness, including this PowerPoint, the taping for today, and then additional resources that Lisa has provided. But there are a lot of supports out there that are free for you to take advantage of. And Lisa's work at the National Center is just one resource that you'll have. And we'll talk about your PDG resources and your National Center resources as well towards the end. But you did have one question in the chat box that I think two questions. One, I think I know the answer to, but I want you to answer. Is family childcare a part of your overall childcare system? And do you address family childcare within your pyramid model supports?
Family childcare is in our overall system. It is not broadly represented in the membership of our early childhood network, but one of our programs that has been recognized for implementation at all levels as a family childcare home. So it's like everywhere, there's a smaller number of them, but they are definitely welcome and part of it, and they are. Great.
And also, do you use mentors within your program to assist with the trauma-informed practice?
So we don't have explicit trauma-informed mentors. What we do have, so our structure is what many folks call program coaches or whatever for the pyramid model. We actually, we have a state training team that supports the development of those folks, and we frequently train them within their own site. Or some of them work with multiple programs, and some of them only work with their own program. But that's how we keep the role of the facilitator is key in our implementation, and they have to sustain a relationship with our network in order to stay eligible for recognition and all of the extra work that we can do for them.
Great, thank you. So now I'm going to turn it over to colleagues in Vermont, to Kate and Lori, and you're going to hear about a whole nother way of implementing the pyramid model in a state. So we really have two different methods for utilizing the model. So I will pass it on to you.
Thank you, Laura. This is Kate Rogers. I am the early education manager at the Agency of Education in Vermont, and I've been there for about 15 years or so. And prior to that, I was working within the school districts in early childhood education and early childhood special ed. So thank you so much for inviting Vermont to present today. I was really excited when I saw the email and hopped on board right off because we love to share our work. We do not ever pat ourselves on the back like you should, and all of you should as well, for all the work you do in supporting young children and families. So this is time to highlight where we've been, where we're going as a state in terms of pyramid model practice implementation. So in Vermont, we call our pyramid model work our early MTSS, and that's early multi-tiered systems of support. And early MTSS balances building a system of those supports through a mixed delivery system in Vermont, given our public and private early childhood programs. Universal pre-K is actually universal. It includes all 3, 4, and 5-year-olds not yet going to kindergarten. There is, it supports everyone. There's no eligibility for economic eligibility or anything like that. So we're proud of that fact that we can reach most all of our preschool age children with universal pre-K programs. It includes center-based childcare, which are some of our pre-K programs, home-based childcare, family-centered childcare, Head Start, and other community partners in order to promote the implementation and use of evidence-based practices to improve social, emotional, and behavioral skills for each and every child in their care. So Vermont began planning and building early MTSS way back in 2007 when we first partnered with CEFAL, our Center for Social Emotional Foundations for Early Learning. And Lisa was part of that. So thank you, Lisa, for hanging in there with all of us through all these years. Again, your expertise and your staff and faculty expertise has been phenomenal, and we cannot thank our TA centers enough to help us move forward with this work. So since 2007, we slowly have pulled together a somewhat, no, I wouldn't say somewhat fragmented, a pretty big fragmented early childhood system in Vermont, and began to build a foundation and infrastructure at the state, at the regional, and at the local level. So that's necessary to affect positive change and outcomes for all of our young children and families. So building a statewide sustainable system. Well, it's taken, this is our 14th year of trying to move things forward. It's not easy. It takes passion. It takes leadership. It takes will to make sure that we're putting in place practices to meet the needs of each and every young child and their family in Vermont. So after the 14 years of lessons learned, oops, sorry, I have to click this, I'm sorry. We figured out if you plan it, if you build it, if you support it, and then ultimately sustain it, they will come. They will thrive. Our data that we've collected over the past 14 years, more or less for 12 years, because we had a gap after the Race to the Top grant funds went away, which was sad. But we saw the positive outcomes that implementing pyramid model practices made in Vermont. We saw the changes in implementation of those practices for teachers within the programs in our cohort sites who were implementing these practices. It was incredible. And we're proud of that. That piece for sure. We want to keep it moving. We want more and more folks to come on board with early MTSS so they too can see the benefits, that it's not only in teaching practices and their skill sets, but the positive outcomes for our children in Vermont. Sorry, I have to switch 2 slides here. My notes slide and the other slide. So just bear with me if there's a slight pause. So I'm going to give you a couple tips. If you are a state who is just thinking about implementing pyramid model practices, or if you're you have some but not all, or if you're actually implementing it too. We heard some of the pieces that I'm going to share with you. We already heard from Ellen what is important as a state to really, really move forward with program-wide to statewide implementation of pyramid model practices. So tip 1. We have to have collaboration across state agencies, the governor's office and state early childhood advisory council. In Vermont, our early childhood advisory council is Building Bright Futures. And that was established, well, actually back in 2006 through an executive order. And BBF regional councils were established as well to support all of our Vermont's early childhood system. So just recently, our Building Bright Futures committee, they presented a revised early childhood action plan for the state with 4 main goals. So, which was wonderful work. It was cross-agency, stakeholder, providing input to all this pieces that is in line with the governor's initiative. So the first goal was to promote the importance and prevention and early identification across the same domain. So all children will have a healthy start. We all want that. We all strive for that. Of course we do. But how we get there is different. How we prioritize what we do, what we measure is going to make a difference. So goal 2 is families and communities play a leading role in our children's well-being, of course. There's no question about that. But again, what we do, how we do it, how we measure, why we do it matters. So this is a priority within this goal to advance policies, practices that honor and are supportive of each family's culture, their strengths, their structure, expertise, and their preferences. So goal 3 is all children and families have access to high quality opportunities that meet their needs. Yes, we absolutely all want that. Again, what do we do to get there? What are our objectives? What are our initiatives? So Vermont is invested in giving children the strongest start possible by creating resources and services that are accessible, equitable, and high quality inclusive settings. Delivering these quality services depends on a skill set and skilled and stable early childhood workforce. That means that workforce crosses our agencies at the state level, at the local level, of course, the regional level. So we have childcare providers, we have preschool, pre-K providers within the school, mental health clinicians, all the childhood workforce that really supports our children and family is part of this. This is where implementing early MTSS and the pyramid model practices scale up and sustainability fits perfectly. Goal 4 is our early childhood system will be integrated, well-resourced, and data-informed. You heard from Ellen that well-resourced and our financial struggles, Vermont certainly has that, and we have to figure out ways, of course, to fund what we believe is best for our state and our families and our communities. And it's tricky. Everybody's competing for the funding sources. early childhood has always been, and I'm sure you could relate to this, kind of on the back burner until we bubble over for something. Then we pay attention to it, and then once that's satisfied, we go back to the back burner. That's not okay. Absolutely not okay. We have to keep our early childhood system on the front burner, so our legislators know and what's going on daily. It's a priority. We know the brain development. We know all these pieces. We have to make sure as advocates that we promote early childhood on that front burner. Okay, there we go. So the next tip is, Vermont has worked very hard to develop a set of guiding principles for the full and equitable participation of each and every child and family. This work was done under the Race to the Top grant that we had received. We call them the GPs. So our GPs articulate Vermont's commitment to fully include each and every child and their family in a continuum of meaningful experiences to ensure their health, their mental health, their safety, their happiness, and success now and into the future. The guiding principles were developed as a project under our Race to the Top grant and took over a 4-year period of time to be established. The GPs went through an extensive state validation process in which close to 92-ish% of all respondents fully endorsed the content of the document that includes families, stakeholders, higher education, school districts, childcare, health, and mental health. So it crossed all those sectors. UVM supported that work in really understanding the family's perspective for our guiding principles and initiated interviews that the family's voice was absolutely heard. And if you want to know more about that, maybe Lori Meyer, who's going to be on in just a couple minutes here, can share a little bit about that work too, because she was involved with that. So very exciting. So tip 2 is make sure your state, you have a vision, you have a mission, but you have a statewide set of early childhood guiding principles that fully supports equitable participation for all of the children, no matter what. Okay, tip number 3 is, you heard Ellen speak about the early learning standards in Pennsylvania. The Vermont Early Learning Standards were revised under the Race to the Top grant funds again. So we did a lot of sprucing up and re-looking at where we were and where we wanted to go as a state, given those funds. And so our early learning standards moved from just being 3 and 4 year old standards to move from birth through grade 3. Of course, and that's our early childhood definition, birth through grade 3. So that's how we revised our early learning standards. They are in line with the Common Core from kindergarten, 1st, 2nd, and 3rd grade. So it aligns nicely. However, it also adds a robust structure in terms of not only reading and math, as the Common Core aligns with, but we also have social and emotional development for K1, 2, and 3, self-regulation, play, exploration, all those wonderful pieces. So it is a comprehensive set of early learning standards that we utilize in Vermont as a foundation for what we do in our early childhood programs here. So the importance of the high quality experiences that are research based is the foundation, of course, to all children's success. So, and the VELs make explicit the goals of each and every child's learning and development. And then, we kind of think of the VELs as a roadmap. that helps us to guide the understanding of what a child may know and what they may do across their younger years, birth through age 8. Okay, so tip number 4 to continue to build your foundation is building the infrastructure here. I don't know where this comes from, and maybe you, as someone, will know, but I like the saying, policy informs practice, but better yet, practice informs policy. And that's where we need to be. That the practice, evidence, research-based practices informs what we do and how we change things over the course of time to benefit our young children and families. So Vermont took a really hard look at its policies, procedures, and practices at the state level and began to push for change. So I'm not going to read all these to you, but you can see that we made ample gains in some of the changes that we did make, including one for developing our early childhood individuals' education plan for children with disabilities who are in need of early childhood special education services, that we incorporated the language from the Division of Early Childhood and their inclusion statements and policy statements for access, participation, and supports. We added those language right into the IEP, so teams who are deciding on goals and objectives for a child who may have disabilities are asking questions that relate to equitable access and how that child is participating and what supports do they need. And hey, do we need training in pyramid model practices? It goes right to that door. So we tried to embed it, that language again within what we were already doing and to make changes as necessary. So let me go to my next slide. And we did also, there was a lot of federal policy that helped to secure the foundation for what and how we're moving in Vermont. And you can see all the joint policy statements are listed here. Expulsion and suspension policies and dual language learners and family engagement. And the new Head Start performance standards and the language in there for supporting children. So all those pieces, as tip 4, are necessary to secure that foundation to promote why pyramid model practices are necessary and how we can move into really exploring that, installing that, going through implementation stages, and ultimately for full implementation and sustainability. So this is just a done deal. This is what we do. I want to get to that point. This is what we do. This is best practice. There should be. It seems straightforward to me, but it takes a lot of work to put it together. So how am I doing for time? Because I want to make sure that Lori gets her time.
You've got about 1 minute.
Laura?
If you can.
Okay. So I'll share some of the funding sources that we use to get to get past the last 14 years. So the Vermont Agency of Education, which I work with, the Vermont Agency of Human Services, the Child Development Division, where our child care lives, the Department of Health, and our Building Bright Futures State Advisory Councils used funding from the Race to the Top Early Learning Challenge grant to really promote it. We also used, through the Office of Special Education Programs, a state personnel development grant. There was a couple rounds of that. We started using those funds back in 2007 when we first became a SEFL state. We still refer ourselves as a SEFL state, Lisa. So anyway, as we move forward, we continue to use the State Personnel Development Grant and the Race to Start funds. We utilized IDEA B and Part C funds. We also applied for and received a preschool development expansion grant that we implemented pyramid model practices within cohort sites for between, I don't know what the dates were. That ended, I think, in 2017. Excuse me for not even having that on the screen. And then we're moved into this last year of work with another round of the preschool development grant that Lori is going to share with you. It is important to really, for the funding piece, to really think about embedding these practices, as Ellen shared from Pennsylvania, into state policy to make sure that the practices are there, even if a single funding stream isn't recognized or put in place. You've got it embedded across the state system to keep it flowing. Okay, I'm going to stop there, and I'm going to hand it off to Lori. So thank you.
Hello, everyone. All right. I'm going to give you a very quick overview of the Vermont Early MTSS 123 project. And if you've ever had the pleasure of being the caboose of a presentation, I put slides that are typically saved for the end up front because I wanted to make sure to get to them in this abbreviated time that I have. This project is funded from Vermont's PDG, and it was a project that was proposed pre-COVID about this same time last year, and it's been implemented during a pandemic. And so first and foremost, I want to thank the people who I consider the superheroes of the project, many who I know are on this call right now. On our left-hand side, you see all of our very talented coaches. This is a pilot project also, as well as an evaluation of Brown quality improvement. Our talented coaches and trainers and our technical assistants from both the Pyramid Model Consortium and Butterfly TTT, who supports the strong curriculum around strengthening families approach. And then our right-hand side, you see all of our regional leadership team members. We could not do the work without them. And next, all of our sites, our program directors, our teachers who are joining us on this journey of a pilot, and our state advisory group. They truly are superheroes. So I'm going to give a very quick overview, and I'm happy to connect with others after today if you have more questions. But what the Vermont Early MTSS 123 project is it's piloting this idea of an improvement support team. So local teams that really support the implementation of early MTSS, and in Vermont, early MTSS, it's said one and the same with the pyramid model approach. And simultaneously, also investigating and thinking about implementing the strengthening families approach, so the 5 protective factors. So these two innovations together, and what does it take in our state to make implementation truly happen? So this just breaks down for you. When we think about our early childhood system, Kate spoke well about our BBF system of regional supports. And so we're piloting this project in 3 regions. We're providing coaching, training, technical assistance, and really looking deeply into what's happening in our active implementation sites. And then we are supported by our project team and our state advisory group. But what I want to leave you with is, Susan, I really enjoyed the map that you shared just a little bit ago. That is an example of what I would call an asset map. I don't know if you've ever thought of it in that way, but this project is taking an assets-based community development approach. And what that means is that we're really seeking to understand our human capital within our state. So what people know, what their experiences are, and what their skills are, and how we might mobilize that into our implementation plans. And the reason why I show you muddy boots is we have mud season in Vermont. So when all of the snow melts, underneath it all is a really great foundation. And in the spring, when that snow melts, it gets pretty messy and mucky. But then the sun comes out and it dries and our foundation is still there. And in some ways, that's akin to Vermont's implementation and support around the pyramid model. We have a really strong foundation. As Kate said, the state has been in this work and dedicated to the pyramid model for 14 years. I have never really seen an innovation in a state more embraced and having so much support as the pyramid model. And there was that little gap in funding recently when the Race to the Top funding went away. So what this project is really capturing is what has happened in the past, all of the good work that is already present, the strengths of our state, what has sustained that work in the absence of funding, and it's helping us take the really high quality resources that has been made available from NCPMI and the Early Childhood Technical Assistance Center. I think one of the strengths of the work that they have put out is that it's really focused and takes into consideration what we know about implementation science. So how do we take those implementation plans and localize it to have it make sense in Vermont, and then mobilize our resources to start moving the needle on where we need to be to really scale up and sustain that work throughout our state. The best is yet to come for our project. We are nearing the completion of the project, so we'll officially wrap things up at the end of March. In the middle of March is when all of our regional leadership teams, our state advisory group members, our directors, our teachers will come together to validate and look at a draft implementation plan that the project will have put together with all that we've learned, our formal conversations, our informal conversations, surveys, just reports from the field. We're really taking when you think about evidence-based practice as a verb, when you think about the best available research, and you take about the wisdom from the field, we are taking that all together. And we hope what we're producing at the end is a plan that can really be actualized in Vermont to take us further into the dream and the vision of where we want to go to truly support the pyramid model implementation in our state.
Thank you so much, Kate and Lori. We really appreciate your wisdom. And I'll let you go ahead and advance to that next slide, Sarah. So first of all, thank you all for the dialogue in the chat box and for asking your questions as we go. Again, these PowerPoint slides and the video from this presentation will be posted on the ECTAS website, and Sarah continues to put it in the chat box. She'll put it in one more time for us. So let me just talk a little about some nuts and bolts of implementing something like the Pyramid Project. So on this next slide, I'm going to refer to the quality activities for CCDF. And really, when we think about the allowable use of your quality dollars, this is a good graphic to keep in mind. Any of these activities are considered allowable in how your state uses their quality set aside, including that infant toddler set aside. So if you can look at the chart, you'll see multiple places where you can access your quality dollars to support the implementation of a pyramid model approach. So it can be implemented under training and professional development, since there's a lot of training and PD that goes along with implementation. It's certainly a high quality program standard if you are looking at increasing program quality by adding some requirements around implementation, whether through training or entering a full-scale implementation model for pyramid. And then that last square that you see is other activities to improve the quality of child care services. This certainly would fall also into that area as another activity. Also, we know that some states have really leveraged private partnerships through foundations to implement pyramid model activities. And so if you're thinking about how to leverage other system supports, a lot of us on this call are ready to help you problem solve and think about where else you can reach out for more funding. I want to draw your attention to one of the newest resources on the from the National Center on Early Childhood Quality Assurance. So on this next slide, Sarah, just showing you the website page for the resource guide for developing integrated strategies to support the social emotional wellness of children. And on this web page, you're going to find links to previous webinars where we kicked off the initiative, but you're also going to find a really nice comprehensive resource guide. And in that resource guide, next slide, Sarah, you're going to find chapters and sections on the benefits of integrating a system. This would be great to take to funders to say, here are the benefits of the initiative we want to do, and we'll save you some work by providing you some good resource materials that you can take with you to funders. It's going to talk about implementation considerations. It's going to outline multiple initiatives that you could think about. And then there's a whole section on implementing the pyramid model. Thank you so much, Lisa, for authoring that section. There's a whole section on infant and early childhood mental health consultation. Thanks to Neil Horan for leading the efforts on that particular chapter. We have a webinar on that topic on Friday of this week. You should have gotten an invitation to that. And then there's also a section on infant toddler initiatives and a relationship-based intervention for infants and toddlers that you're welcome to look at in the resource guide. Next slide, Sarah. There's a chapter that really looks at thinking about social emotional wellness from a school age perspective and how to integrate strategies for school agers. We have a section on the allowable use of CCDF funds. We have some charts that kind of give you a landscape of who's using pyramid model in their QRIS systems and what states are implementing pyramid, what states are implementing mental health consultation. And then we have tons of great resources for you that you can pull down. And then, of course, links to our federal technical assistance. So I'm going to talk about federal technical assistance in one moment, but I want to add a poll real quick. So, Sarah, I'll let you move on to this poll. 2 questions for you on this poll. First is, where are you right now in thinking about the pyramid model? Are you excited to start exploring, or are you at the other end of the spectrum, you're fully implementing? So if you could just let us know where you are in your journey with the pyramid model, that would be great. So it's really nice to understand who's exploring, because then we can certainly target some resources towards you and your colleagues in your state, territory, or tribe. So this is great. So we have a lot of people who are excited to start exploring and a lot of people who are partially implementing the model. So wherever you are in your journey, if you're fully implementing, but you're thinking about research and evaluation and maybe some revamping like Pennsylvania is, please feel free to reach out to your technical assistance support people to help you think through that. So this next slide, Sarah, really is going to, oh, thanks, Sarah. We have one more poll. Are you interested in receiving some technical assistance? Do you want us to reach out to help you get started? So let us know if you're interested in receiving technical assistance. Sometimes we offer community of practices so that we can put you all together in a peer-to-peer forum and you can learn from each other. If you're just thinking about pyramid, we would offer a more basic community of practice and really kind of dig into the nuts and bolts of the pyramid approach. So it looks like we have some people who are interested in that. So thank you for that. So let's move on to that next slide, Sarah. As I'm watching we'll go to one more slide since I got most of the questions while we were going through it. I just want to make sure that everyone knows that there is free technical assistance out there. So for most of you who are on the phone, you may not know that there are state system specialists who are assigned to regions, and those state system specialists really help to navigate the technical assistance system. So they'll work with the CCDBG administrator, CCDF administrator in your state, territory, or tribe. They'll work with the regional office to help understand what your technical assistance needs are, and then they can attach you to the right national center to meet your needs. So through any of these three email addresses, you could reach out, and then we can make sure that we are following the right protocols to get you the technical assistance. So you can find me at the National Center on Early Childhood Quality Assurance if you're interested in technical assistance. If you're a PDG state, don't forget to reach out to Mandy and Missy. They are certainly happy to support your efforts and attach you to some TA supports. And you can also always reach out to the National Center for Pyramid Model Innovations, and they'll loop us back in to the national TA approval process. So again, don't hesitate to reach out. There's really no wrong door to ask questions. All of us at the national centers understand how to work through the protocols of getting a TA request accepted and approved. So we'll be happy to help you navigate that system. So Ellen, I would love to just turn it over to you for some final thoughts. I want to thank everyone for joining us and being on for this call. Thank you to our presenters. And Ellen, I'm going to pass it on to you.
Thanks very much. Thank you for participating in this. I hope that you see in it things that will really help all of the child care providers in your state, territory, or tribe. You have available to you a number of examples. Another thing that Laura didn't mention, but it's also possible, is a peer-to-peer contact. So if you listened to what was going on in Pennsylvania or Vermont and thought, wow, that state's a lot like mine, or it sounds like I'm where they were, the TA system can help connect you directly to the state. I know that this is an important moment in time. There hasn't been a time like this in our lifetimes where the social and emotional health and well-being for young children and the people who care for them, it has never been more vulnerable. And here are the opportunities you can take to jump in and find ways to support them. So on behalf of the Administration for Children and Families and the Office of Child Care, thank you very much and have a really great day.
Thanks, everybody. Take care.